to this newscast with WION's continuous and comprehensive coverage on coronavirus. We focus on India at the moment, as the number of coronavirus cases in the country has now risen to 147. This as 10 more people tested positive in the last few hours. Remember, the count was just 137 yesterday. Now, new cases have been confirmed in Delhi, Ladakh and Maharashtra. With 3 new cases, total number of infections in Maharashtra has now risen to 41. Remember, as you can see in this breakup of the map, Maharashtra remains India's worst hit state by the outbreak. Ladakh confirmed 2 fresh cases, while Delhi confirmed 1. And UP and Kerala have confirmed 1 new case each. India so far has 3 COVID-19 fatalities. Let's quickly get in a sense of ground zero, and for that I'm joined in by our principal diplomatic correspondent Siddhant Sibal on the phone line for more. Siddhant, a rise of 10 cases is a spike in the overall trajectory of the virus in India. That certainly brings the focus now on testing and how private labs could also play a role. Not to forget, housing societies have also been instructed by the district magistrate to follow protocols to avoid community transmission. That's stage 3, which India is now trying to avert. How is the government using a multi-pronged strategy to contain the virus?
Well, Aranksha, multi-pronged strategy has already been put in place since 8th of January, and since then we have seen measures being put in place by the government on a daily basis. There have been press conferences on a daily basis, we know that. But I can tell you the number of active cases in India is at 130 right now, and almost 14 people have recovered as well. So that also shows the silver lining to the entire crisis. We know that Maharashtra stands the highest number of cases at 38. But by and large, we know that government is putting in place a social distancing policy so that the spread is less. And we also know that India is in the stage 2 of the crisis right now. As of now, there is no confirmation of community transfer happening here in India. But we do expect India to beef up more measures, expect more measures announced by the government today.
No, right now, Siddhant, what's also important to talk about is how now the focus should shift on testing and more testing kits to be brought in. Not to forget that the societies need to play a very vital role by going into a sanitation overdrive.
When it comes to society, awareness is something that the government and the society is focusing on. We know that how there have been awareness campaigns. In fact, at my society, there were campaigns today morning on making sure that there is awareness. Cleaning of hands is something that is being focused on. Testing is another big focus. We know that only 11,500 people have been tested so far since January 21st, and given the fact that we are a huge population, 1.1 billion, so that is something that is not a positive news. India is now focusing on more and more testing. As of now, random testing is being put in place. We also know India is beefing up its capacity when it comes to laboratories, and for that we know that India is roping in private players as well. These private players have been advised by the Indian government to do the testing for free, and many of them have also accepted for the cause of this larger crisis to make sure that the crisis subsides. They are willing to do free testing.
Right, and you know, from what we are learning, that the RWAs have also been advised to actually disinfect the societies, because let's not forget that India is in stage 2 and stage 3 is what is basically community transmission. Now, Siddhant, we're also learning that an Indian Army Jawan in Leh has tested positive, making him the first case in India's armed forces. What are you learning about his condition?
No, there is no official confirmation by the Indian Army regarding that, but this Jawan could be at any place, because at the end of the day, he might be going to his family. He could have got the infection, and we know that the number of cases in the Union Territory of Ladakh is pretty high. It is at 8, and that, of course, shows that how the situation is not very good in that Union Territory. In fact, one thing I can tell you, that there are many Indians from the Union Territory of Ladakh in Iran right now, approximately 250 Indians who have been confirmed with this virus. So this is a cause of concern. We spoke to the Indian government yesterday at the press conference, to which the Indian government responded by saying that they are aware of the condition.
And since you mentioned these Indians abroad, I was just about to come to that. Several Indians are stuck not just in Iran, but also in Italy, some even in transit in Malaysia on their way back from Philippines, and some are even on board the Grand Princess cruise in the United States. What's the status of the evacuations?
evacuation is something that Indian government has been
Yes.
since January. And we know that India has evacuated so far 144 people, including 48 nationals of 10 countries. Right now, evacuation when it comes to Iran and Italy is the focus. India is in the process of getting more people, specifically from Iran. There are 1,000 Indians stuck in Iran, but it has now become a global crisis. We are getting reports of Indians stuck in Europe, in Southeast Asia, who would like to come back. There are many reports of Indians stuck in Poland who have been hoping that the Indian government will get them back, given the fact that there is no movement of flights happening between India and European Union. So this, of course, remains top priority. The main coordinator of the Indian government is coordinating when it comes to bringing back people. But right now, the message by the Indian government is stay put wherever you are. They do not want people to go around here and there, and that can increase the spread of virus.
Absolutely. To stay put is the sensible way out. Thank you so much, Siddhant Sibal, for bringing us all the latest updates on the state of coronavirus in India at the moment. And with that, let's now bring you more updates as the Health Ministry of India is now planning to enhance the capacity for diagnosis and detection of coronavirus, as we were just discussing. And the Health Ministry has also decided to allow accredited private labs to conduct tests across the country. By the end of the week, it hopes to increase the number of testing labs to 121 and also enhance the number of people who are being tested.
All the private testing laboratories ensure immediate real-time reporting to the state officials of the IDSP, that is the Integrated Disease Surveillance Program of the Government of India and ICMR, for timely initiation to contact tracing, and so that once the patient is identified as positive, he can be isolated. So they have to, that responsibility will be theirs to identify. The responsibility of getting the reagents will be theirs. Getting the probes will be theirs. Getting we will give them the positive control, we will give them SOPs, and we'll be delighted as soon as they get that, we will give that to me. ICMR also strongly appeals that private laboratories should offer COVID diagnosis at no cost. They have come forward to help as a national crisis. If they want, it will be appreciated. It is an appeal.
The Indian Medical Research Council has laid out the roadmap for the current virus situation in India. All COVID-19 tests across the country will now be conducted free of cost. Apart from this, all the high-quality private labs have been appealed to conduct free testing. The ICMR is working on increasing the accessibility and availability of the coronavirus tests and has placed orders for 1 million probes, reagents and unlimited primers from the World Health Organization. The Indian Medical Research Body is reviewing and updating the advisories for testing the virus periodically. As per the current advisory, all those who have taken international flights in the last 14 days have been requested to practice self-quarantine even if they have not shown any symptoms at all. And the health workers will undergo tests if they show symptoms.